Frequent nighttime urination or nocturia disrupts sleep, drains energy, and contributes to falls, fractures, and cognitive decline in older adults. For many, nocturia and unstable blood sugar go hand in hand. Fluctuating glucose levels can increase urine output, while nighttime trips to the bathroom can spike stress hormones that worsen insulin resistance. But beneath this vicious cycle lies a promising truth. Nutritional deficiencies are often an overlooked cause of nocturia, and targeted vitamin support can play a powerful role in reducing nightly bathroom visits while also helping regulate blood sugar. Here is an in-depth look at the top 10 vitamins that can address both concerns and how they may improve overall quality of life for older people. Vitamin B12 stands as the first and arguably most essential nutrient in the fight against nocturia. Older adults are at high risk for B12 deficiency due to reduced stomach acid, medications like metformin, or gastrointestinal issues that limit absorption. Low B12 has been linked to nerve dysfunction, including the bladder's sensory and motor nerves, leading to increased urgency and frequency of urination. By restoring B12, the bladder's nerve control may improve, reducing nocturia episodes. At the same time, B12 supports energy metabolism and can help stabilize blood sugar by enhancing carbohydrate processing and reducing neuropathy-related complications of diabetes. Vitamin D is another key player. This fat-soluble vitamin helps regulate calcium balance in muscles and nerves, including the bladder's detrusor muscle. Deficiency in vitamin D has been associated with overactive bladder symptoms, frequent urination, and pelvic floor weakness. Research suggests vitamin D supplementation can decrease nocturia episodes, especially in postmenopausal women and older men with enlarged prostates. Beyond bladder health, vitamin D enhances insulin sensitivity, reduces systemic inflammation, and has been linked to better blood sugar control in diabetics. Vitamin C, well known for its immune-boosting abilities, also plays a role in bladder integrity. Adequate vitamin C helps strengthen connective tissue, including the bladder lining, making it less prone to irritation that can cause urgency. Vitamin C's antioxidant effects reduce oxidative stress, a major contributor to diabetes complications, thereby indirectly supporting glucose balance. However, it's important to avoid megadoses of vitamin C, which can sometimes irritate the bladder. Instead, moderate daily intake from food or supplements is best. Vitamin E offers unique benefits for older adults facing nocturia and blood sugar swings. As a potent antioxidant, vitamin E supports healthy blood vessels and nerves, both essential for proper bladder function. In diabetics, vitamin E has been shown to reduce oxidative damage to pancreatic beta cells and improve insulin action. Studies indicate that vitamin E may help prevent bladder overactivity by modulating inflammatory pathways that affect bladder control. Vitamin B6 emerges as a quiet but crucial hero. Deficiency in B6 can cause nerve dysfunction, mood disturbances, and weakened bladder control. Since B6 is a cofactor in many neurotransmitter pathways, it can affect the signals that tell the bladder when to hold urine. Supplementing B6 may calm bladder overactivity while also improving insulin secretion and glucose tolerance. For older adults, replenishing B6 could mean fewer nightly awakenings and more stable daytime blood sugars. Vitamin A is often overlooked in discussions about urinary health, but it plays a significant role in maintaining the epithelial lining of the bladder and urinary tract. A healthy, well-lubricated bladder lining is less likely to become irritated by acidic urine or infections, both of which can trigger nocturia. Moreover, vitamin A's antioxidant power supports eye health and immune function, which indirectly benefits diabetics who are prone to infections and complications. Vitamin K2 is another nutrient gaining attention for its dual role in urinary and metabolic health. While best known for directing calcium to bones and away from arteries, K2 also helps maintain smooth muscle tone in blood vessels and possibly the bladder wall. Improved bladder muscle tone can reduce urgency and frequency. At the same time, K2 may enhance insulin sensitivity, reduce vascular calcification, and lower cardiovascular risks common in older diabetics. Vitamin B1, or thiamine, completes the trifecta of bladder-supportive B vitamins. Deficiency in thiamine can cause nerve dysfunction that mimics diabetic neuropathy, leading to overactive bladder symptoms. Supplementing thiamine can help restore nerve function and reduce nocturia. Additionally, thiamine is vital for glucose metabolism. Low levels can worsen hyperglycemia and fatigue, while adequate B1 can improve energy and reduce cravings. Vitamin B3, known as niacin, supports circulation by dilating small blood vessels, including those feeding the bladder and kidneys. Improved blood flow can aid bladder health by reducing ischemia-related dysfunction, a cause of nocturia in older adults. Niacin also helps regulate cholesterol and triglycerides, which often accompany diabetes. While high-dose niacin can sometimes increase insulin resistance, moderate doses can support healthy lipid profiles and circulation. Vitamin B5, or pantothenic acid, rounds out the top 10 with its role in adrenal function and stress hormone balance. Excess nighttime cortisol can worsen both nocturia and blood sugar spikes. Vitamin B5 supports adrenal health, helping blunt inappropriate nighttime cortisol surges and leading to more restful sleep. Stable cortisol can reduce nighttime bathroom trips and minimize insulin resistance, creating a healthier metabolic environment overall. Taken together, these 10 vitamins offer a nutritional foundation that addresses the intertwined challenges of nocturia and poor blood sugar control. They do not replace medical treatment for conditions like diabetes or prostate enlargement, but they can complement standard therapies by tackling deficiencies that worsen nighttime urinary frequency. Older adults considering these vitamins should do so under the guidance of a healthcare professional, especially since interactions with medications and other health conditions are possible. Adequate hydration, bladder training, dietary changes, and proper management of underlying diseases should always accompany any vitamin regimen. Beyond simply supplementing these vitamins, it's important to understand how they interact with lifestyle factors that can either support or sabotage their benefits. For example, certain diuretics commonly prescribed for high blood pressure in older adults can deplete B vitamins, especially B1 and B6, compounding nerve and bladder dysfunction. Meanwhile, long-term use of proton pump inhibitors for acid reflux can significantly lower absorption of vitamin B12, setting the stage for nerve-related bladder problems and unstable blood sugar. This creates a vicious cycle. Medications that help one issue may quietly worsen another if nutritional balance isn't maintained. Another factor often overlooked is dietary patterns. Diets high in refined carbohydrates and low in nutrient-dense foods can accelerate vitamin deficiencies, especially B vitamins, which are quickly depleted by chronic high blood sugar and stress. Encouragingly, including vitamin-rich foods such as leafy greens, B vitamins, vitamin K, fatty fish, vitamin D, colorful vegetables, vitamin A and C, nuts and seeds, vitamin E, and whole grains, B vitamins, can provide foundational support. These choices nourish not only the bladder and nervous system, but also directly stabilize blood sugar throughout the day. There's also a significant link between nocturia and magnesium, a mineral often paired with vitamins in supplements. Magnesium deficiency can cause bladder muscle spasms that worsen nocturia, while adequate magnesium supports insulin sensitivity. While magnesium isn't a vitamin, It works synergistically with B vitamins and vitamin D, highlighting the importance of a comprehensive approach rather than focusing on isolated nutrients. Sleep quality itself becomes a critical piece of the puzzle. Frequent urination disrupts deep sleep, yet poor sleep increases insulin resistance the following day, worsening blood sugar control and creating a feedback loop that's hard to break. By targeting nutritional deficiencies with these vitamins, it's possible to support the nervous system and bladder control mechanisms needed for uninterrupted sleep. Longer, deeper rest can then improve glucose metabolism, making daytime blood sugar easier to manage. For those struggling with both nocturia and diabetes, it's essential to remember that these vitamins are tools, not miracle cures. Vitamin support can optimize the body's ability to respond to bladder training, pelvic floor exercises, and dietary strategies such as limiting evening fluids and avoiding bladder irritants like caffeine, alcohol, and acidic foods. Combined with proper diabetes management, including regular blood sugar monitoring, medication adherence, and physical activity, vitamins can contribute to fewer nighttime trips to the bathroom and steadier glucose levels. It's worth noting that some older adults may benefit from a personalized approach, including lab testing for vitamin deficiencies. Measuring serum B12, 25-hydroxyvitamin D, or functional B vitamin markers can guide targeted supplementation, avoiding unnecessary or excessive doses. Since fat-soluble vitamins, A, D, E, K, can accumulate to toxic levels if overused, careful dosing is especially important for these nutrients. An often ignored but powerful aspect of vitamin support is timing. Taking certain vitamins in the morning, such as B vitamins, can support daytime energy and metabolism while avoiding nighttime stimulation that could worsen sleep. Meanwhile, vitamins like vitamin D and K, taken earlier in the day, can promote better circadian rhythm alignment, which is emerging as a key player in both bladder and glucose regulation. Respecting the body's internal clock while nourishing it with the right vitamins creates an environment that naturally favors nighttime bladder calmness and healthier blood sugar control. Finally, older adults must stay vigilant about hydration. It's tempting to restrict fluids drastically to reduce nighttime urination, but dehydration can irritate the bladder, worsen constipation, and destabilize blood sugar. The goal should be strategic fluid timing, drinking more fluids earlier in the day and tapering off by evening, while maintaining steady electrolyte and vitamin intake to keep the body balanced and comfortable overnight. The emotional impact of nocturia and blood sugar instability in older adults is profound, yet rarely discussed. Chronic sleep disruption from frequent nighttime urination can lead to feelings of frustration, depression, and social withdrawal, especially when older adults begin avoiding evening social activities out of fear of accidents or embarrassment. These emotional struggles can worsen stress hormone levels, further destabilizing blood sugar and creating a loop that seems impossible to escape. Nutritional support through targeted vitamins offers a glimmer of hope by addressing root causes of nerve dysfunction and muscle instability, giving older adults a renewed sense of control and dignity. Cultural and societal factors also shape how nocturia and diabetes are managed. In many communities, conversations about bladder issues remain taboo, preventing older adults from seeking early help or discussing symptoms openly. This silence can lead to advanced bladder dysfunction, repeated urinary tract infections, and dangerous falls during nighttime trips to the bathroom. Educating families, caregivers, and older adults about how vitamins like B12, D, and K2 can support bladder health not only empowers individuals but also breaks down stigmas, making it easier for seniors to receive comprehensive, respectful care. Meanwhile, healthcare providers can play a crucial role by recognizing signs of nutrient deficiencies, before they manifest as full-blown bladder or glucose complications. Simple screening questions, like asking about tingling in the hands or feet, a sign of B12 or B6 deficiency, unexplained muscle cramps, possible magnesium or vitamin D deficiency, or new onset of frequent urination, can prompt early nutritional interventions that prevent months or years of unnecessary suffering. Doctors and nurses trained to view nocturia not just as an inevitable part of aging, but as a potential marker of nutritional imbalance, are better equipped to recommend vitamin testing and personalized supplementation. Beyond individual vitamins, certain combinations can work synergistically for more profound effects. Pairing vitamin D with magnesium, for instance, enhances both nutrients absorption and utilization, boosting bladder muscle function and improving insulin sensitivity more than either nutrient alone. Similarly, B6 and B12 work together in methylation pathways essential for nerve repair, meaning supplementing both may yield better results for bladder control than focusing on one. Older adults must also be mindful of potential interactions. For example, vitamin K2 can affect blood-thinning medications like warfarin, requiring close monitoring if K2 is added to the regimen. High doses of niacin, B3, may worsen blood sugar control in some diabetics, making it critical to use moderate, physician-guided dosing. These nuances highlight the importance of involving a healthcare professional when using vitamins therapeutically, especially in the presence of complex medical conditions or multiple medications. The importance of a holistic strategy cannot be overstated. Vitamins alone without broader lifestyle changes will likely disappoint. Bladder training, practicing holding urine for gradually longer periods, strengthens the bladder's capacity and reduces urgency. Pelvic floor exercises, Kegels, tone the muscles supporting the bladder and urethra, giving older adults more control over leakage or sudden urges. Weight management can also ease pressure on the bladder while improving insulin sensitivity, directly reducing two root causes of nocturia. Together, these strategies multiply the benefits of vitamin support, creating a sustainable path to better nights and healthier days. For caregivers and family members, understanding how nocturia and blood sugar are linked through nutritional deficiencies can transform the support they provide. Encouraging nutrient-dense meals, assisting with vitamin routines, and creating a safe nighttime environment, such as using night lights and removing tripping hazards, can reduce the risks of nighttime falls and give older adults the confidence to sleep peacefully. By integrating targeted vitamins with lifestyle modifications, emotional support, and proactive medical care, older adults can break free from the exhausting cycle of nocturia and fluctuating blood sugar. Instead of dreading the night, they can reclaim restful sleep, improve energy, and enhance overall well-being. To truly appreciate the power of these vitamins in addressing nocturia and blood sugar swings, it helps to look at what happens when deficiencies remain untreated. Over time, unchecked nocturia can lead to chronic dehydration, especially in older adults who limit fluids out of fear of accidents. This dehydration strains the kidneys, increases the risk of urinary tract infections, and thickens the blood, which can contribute to higher blood sugar levels and dangerous clotting issues. Meanwhile, ongoing vitamin deficiencies can worsen neuropathy, further disrupting bladder nerve signals and making nocturia more frequent and severe. On the blood sugar front, deficiencies in B vitamins, particularly B1, B6, and B12, have been implicated in the progression of diabetic neuropathy, which not only affects the feet and hands, but also the nerves controlling the bladder and digestive system. When these nerves become damaged, the bladder may either empty too frequently or retain urine excessively, both of which increase infection risk and lead to more severe complications. Vitamin D deficiency, on the other hand, has been linked with insulin resistance, a root cause of type 2 diabetes, meaning that without addressing low D levels, blood sugar control efforts may be fundamentally undermined. Older adults often don't realize how common these deficiencies are. Factors like reduced sun exposure, digestive changes that impair nutrient absorption, medications that deplete key vitamins, and limited diets all contribute to widespread deficiencies in seniors. For instance, it's estimated that up to 50% of older adults have insufficient or deficient vitamin D levels, while B12 deficiency affects nearly 1 in 5 people over age 60. Such statistics underscore why simply eating a standard diet may not be enough to correct the underlying causes of nocturia and blood sugar instability. For those skeptical about vitamins making a real difference, several studies provide compelling evidence. Clinical trials have shown that vitamin D supplementation can reduce overactive bladder symptoms, while research on B12 replacement therapy has demonstrated improvements in bladder function among those with neuropathy. Additionally, observational studies suggest that seniors with higher vitamin K2 intake experience better muscle tone and fewer falls, which indirectly supports healthier bladder control at night. Although more large-scale studies are needed, the existing research highlights the significant role that targeted nutritional support can play in maintaining both bladder and metabolic health. Proper supplementation strategies can vary based on individual needs. Some older adults may benefit from a high-quality multivitamin designed for seniors, which covers most of these vitamins at safe, moderate levels. Others, especially those with known deficiencies or advanced diabetes complications, may require therapeutic doses of specific vitamins prescribed by a healthcare professional. Liquid or sublingual, under the tongue, forms of B12 can be particularly effective in those with digestive issues that limit absorption of pills. For vitamins like D and K2, pairing them with a meal containing healthy fats improves their absorption, as both are fat-soluble. Also, it's essential to remember that consistency matters. Occasional vitamin use will not correct chronic deficiencies or reverse years of nerve or bladder damage. For meaningful results, vitamins must be taken daily over weeks or months, combined with lifestyle adjustments like dietary improvements, stress reduction, regular physical activity, and adherence to medical recommendations for underlying health conditions. Together, these strategies can help older adults regain the uninterrupted sleep they deserve, stabilize blood sugar to reduce the risks of diabetes complications, and improve overall quality of life. Addressing nocturia through nutrition not only targets an embarrassing and frustrating symptom, but also tackles the deeper metabolic issues that can steal health and independence in later years. While vitamins can offer a significant boost in the fight against nocturia and unstable blood sugar, their benefits extend beyond simply reducing symptoms. Supporting bladder and nerve health can increase confidence in social settings, allowing older adults to attend evening events, sleepovers with grandchildren, or travel without the constant fear of disruptive nighttime bathroom trips. Restoring a sense of freedom and control is perhaps the most overlooked benefit of addressing nocturia with targeted nutrition. Moreover, stabilizing blood sugar through optimized vitamin intake can reduce the frequency of dangerous blood sugar highs and lows that often plague older adults with diabetes or prediabetes. This, in turn, minimizes the risk of diabetic complications like kidney damage, vision loss, and cardiovascular disease, all of which can shorten lifespan and erode quality of life. By supporting the nervous system, immune health, and muscle function, vitamins offer a holistic approach that tackles multiple aspects of aging, not just the bladder or blood sugar. For older adults who already follow medical treatments for bladder issues or diabetes, adding vitamin support can often enhance the effectiveness of existing therapies. For instance, medications like metformin are known to deplete vitamin B12. Supplementing B12 can restore balance, reduce nerve complications, and support better bladder control. In other cases, addressing deficiencies may even allow for lower doses of medications, reducing the risk of side effects like dizziness, dehydration, or low blood sugar. Older adults should consider building a partnership with their healthcare providers, discussing not only medications and symptoms, but also diet, supplement use, and signs of nutritional deficiencies. Periodic lab tests can confirm whether deficiencies have been corrected, and adjustments can be made over time to maintain optimal levels. Medical disclaimer. This content is provided for informational, educational, and entertainment purposes only, and is not intended as medical advice, diagnosis, or treatment. The information in this essay should not be used as a substitute for professional medical advice or care. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or before starting any new supplement or treatment. Do not disregard professional medical advice or delay seeking it because of something you have read here. Results from vitamins or other interventions may vary based on individual health factors. Viewer discretion is advised.